If you suffer from stomach bloating, you probably know that it often indicates certain not-so-serious malfunctions in the stomach, such as lactose intolerance or overeating. However, it may also be a sign of something more dangerous, such as cancer. But, you need to know when you should worry about other health issues, and when it is a case of some less dangerous health problem. This video explains several cases in which you should check if stomach bloating is linked to some other more serious health issue. Vaginal bleeding or blood in your stool. Bloating can be associated with irregular bleeding in women, which occurs between periods or after menopause. Even though in most cases this does not indicate some more serious health issue, it may show the presence of some illness or health disorder, including irregular menstrual cycle, hemorrhoids, fibroids, or endometrial atrophy. Fever. If you experience stomach bloating and fever at the same time, it is probably a sign of inflammation or infection. Namely, you probably suffer from pelvic, urinary, or gastrointestinal infections if the number of white blood cells got bigger. Ascites. It happens due to an abnormal amount of liquid that is secreted in your abdomen. It is a condition in which you suddenly gain more weight and your waistline expands. In this case, you can feel so bloated and women can even think that they are pregnant. In most cases, this indicates a liver disease. It can also be a sign of hepatitis, and bloating in combination with jaundice turns the skin in the eyes yellow, which is a definite sign of cancer spread to the liver. Weight loss. If there is no specific reason, if you haven't changed your diet or the regular physical activities, especially if you lose 10% of your general body weight, it is a clear indication of a disease. You could have a tumor that secretes some liquids which suppress your appetite. On the other hand, it can also be a sign of potential cancer in the intestines, which presses the stomach, and you consequently feel full even after a small amount of food. Moreover, sudden and severe pain in the abdominal area, accompanied by bloating, nausea and vomiting can also indicate an obstruction made from scar tissue or even bowel tumor. You should immediately consult your doctor in order to avoid bowel perforation, for it may have fatal consequences. The bowels are full of food and juices, and as they try to push all of that through the obstruction, so you feel acute pains that come in waves. Bloating can also be a sign of cancer and some more serious health issues, including diverticulitis. Comes as a result of a combination of several conditions: abdominal pain, bloating, and fever. All these are accompanied by diarrhea or constipation. In this case, treatment with a liquid diet and antibiotics is needed. By a CAT scan, abscess can be excluded, which is a complication that can even require surgery. After all complications have passed, a high-fiber diet is advised. Crohn's disease. The main symptom of this disease is bloating, and other symptoms are joint pain, inflammation in the eyes, mouth ulcers, and skin lesions. It is an autoimmune disease that affects the GI tract and the small intestine and the colon. Furthermore, bloating can lead to colon obstructions, which can be accompanied by weight loss, nausea, vomiting after eating, and blood in the stool. Pelvic inflammatory disease happens in the case of infected ovarian or fallopian tubes, mostly by sexually transmitted diseases, gonorrhea or chlamydia. That can happen during miscarriage, abortion, childbirth, or insertion of an intrauterine device. A pelvic exam should be made, and it is usually treated with antibiotics because it can lead to infertility or ectopic, tubal, pregnancy. Liver disease. In most cases it is a benign, and not a serious issue, but it can cause the cancer cells to spread from it to the other organs. That is due to the blood which is filtered through it, and when the cancer cells are into the bloodstream, they will pass through the liver. The risk factors are bloating accompanied by ascites and jaundice. Liver cancer can develop in people who have a history of hepatitis or overuse of alcohol. Stomach cancer. Stomach cancer in most cases shows no symptoms at the beginning. In its following stages, bloating, indigestion, and a feeling of fullness in the upper abdomen are experienced. Unfortunately, in some cases, it is diagnosed when it is already in its dangerous stage, so the range of symptoms can spread to weight loss and nausea. However, the bacteria Helicobacter pylori is another risk factor and at the same time the main reason for stomach cancer. Uterine cancer. Risk factors for uterine cancer are radiation therapy, tamoxifen, a family history of colon cancer called Lynch syndrome, taking estrogen supplements, or a family history of uterine cancer. The symptoms, in this case, are pelvic pain, pain during sex or urination, abnormal vaginal bleeding, and vaginal discharge, which is watery and with blood. Pancreatic cancer. Pancreatic cancer is one of the most aggressive cancers and with the highest death rate. It has several symptoms, such as diabetes accompanied by back and abdominal pain, bloating with jaundice, poor appetite, weight loss, and upper abdominal pain. Ovarian cancer is the fifth most likely cancer in women. The symptoms are persistent bloating, feeling full fast, and pelvic pain. Women over 50 are mostly exposed, and the risk factors are not having children or having them late in life, obesity, family history of this kind of cancer, long-term hormone therapy. Colon cancer. Colon cancer can appear at the end of the colon or somewhere at the beginning. If it is in the middle or at the end, the bloating can only be an initial symptom. If it is at the beginning, it causes persistent bloating, bleeding, and the situation is very likely to worsen. Changes in lifestyle habits and starting a natural diet based on plants can prevent this kind of cancer.